I'm sorry.
But the traffic
Thing is that I can see
got off.
I've had problems with our babysitter.
everything.
Yeah.
Good evening. It is 5:30. If we can all stand up for the pledge.
That's a ending story as well.
I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Right. So Dr. Fleming is running minutes behind, and Kathy is at warmer temperatures. Terry, it's nice to have you back with us.
Thank you.
If everyone hopefully has had a chance to review the minutes, if I can have a motion to approve the minutes of January.
Motion to approve?
A second?
Second.
Okay, Dr. Bunsen,
Yes.
Dr. Brunt,
Yes.
Dr. Fleming.
He is not here
Sorry.
yet.
Robin,
Yes.
Dr. Rosan,
Yes.
Terry.
Yes.
Thank you.
Thank you. The next board meeting is scheduled for March 5th, and if there is any new business. Nope, okay. Any old business? Thank you. Then we're on to the report of our attorney.
The last month or so has reminded me of what I used to do for you versus what I now do for you. The staff has graciously provided me the annual list of tattoo parlors who haven't paid their permit fees.
Oh, okay.
And today I got the list of restaurants that haven't
Yes, we
paid
got
their. Usually we spent January and February every year chasing these people around. So now we're going to chase them around again. On a more exciting note, and we'll hear from the staff tonight about these things, I'm beginning to be drawn in to some of this stuff. And the closer I get to it, the more exciting it is. And we're very, very fortunate to be living in an age when finally Indiana has decided that public health is a priority. So we'll continue to work with the staff and hopefully make their job a little easier. And that's the end of my report.
Thank you.
Unless you want to go with me to close down tattoo parlors.
All right, so
Wait, anybody want to guess how many tattoo parlors we have in Porter County?
I have-
Oh, what did Dan say?
It's 40-something.
we have,
Oh, there's Dan. How many are there?
I thought it was 42.
30 plus tattoo parlors.
Wow.
And what percentage
Yeah, have
did
not-
not renew their permit
percentage-
by
What,
the first of the year?
probably 20% of them?
20%. Okay.
15, 20%.
Is that usual every year? Is this, I don't remember having this discussion. Thank you. I mean,
And I
Now,
saw
there
there were
is an-
11 or
there is
12
an angle.
restaurants.
There is an angle to all this because when we were having this problem 15 years ago, we decided we needed to get their attention. So we increased
Yeah.
the delinquent fee by doubling what you have to pay. They're falling back into their old habits again. Now, the other hand, if nobody paid on time, our revenue would go up.
double edged.
End of report,
Right.
Madam Chair.
Thank you, sir. Thank you. Have you signed?
Yes.
Okay, so we have, pass it. If we could have a motion to approve our claims and receipts? Motion by Dr. Fleming. A second?
Second.
Second, good.
Okay, Dr. Bunsen,
Yes.
Dr. Brunt,
Yes.
Dr. Fleming,
Yes.
Robin,
Yes.
Dr. Rosan,
Yes.
Terry.
Yes.
Thank you.
Thank you. Reports of committee, staff, and health officer. You guys can choose your order of.
You want me to have Shannon go first? All right. So on the agenda tonight, underneath our reports, you see that we had a couple of proposal presentations. Sheriff Ballin was not able to be here tonight. We can talk very briefly about the visit that we had with him and then look forward to his proposal next month. But Shannon Burhans from the Portage YMCA is here, and she has a presentation for us for a proposal of a partnership that we would like to enter into with them. What would you like me to put, Shannon? got the video, and then that good? Okay.
Thank you for joining us.
Yeah, thanks for having me. So we have worked very closely with the health department in the past, and so the Ys just in general across Indiana are really excited that the state is also recognizing some of our evidence-based programs and understanding the importance of keeping our community healthy and making some strides to improve our health overall. So our partnership agreement is really kind of on that same front and really requesting some funding to open access more to people who are in need for 3 programs in particular: our diabetes prevention program, our blood pressure self-monitoring program, and then enhanced fitness. So this first one actually is just a quick overview of the diabetes program. So you can go ahead.
We typically refer patients to the YMCA Diabetes Prevention Program because we know that there's a very short time frame to make that impact. And I think that they're so excited about going because they have such a good community recognition of the YMCA. So when we say the YMCA has this great program, and we can talk about the fact that it's an evidence-based program from the CDC, and the YMCA is going to do it, it's kind of a perfect blend for most of our patients who might have a little bit of hesitation. We know that they give us a lot of feedback on how our patients are doing, which as a provider, we feel very confident in kind of passing our patients on when we know they're going to be very well cared for. When we have our patients who are at risk for type 2 diabetes, especially our seniors, one of the greatest benefits we find with the YMCA Diabetes Prevention Program is that we can actually get them engaged in a community, and they can also help our patients just kind of feel a little bit more secure while they're trying to make these lifestyle changes. So for most of us, we feel very confident in saying the YMCA has taken this concept and they've developed it and they've put it in the community, and they're also providing the gym membership and the other opportunities that they have for our patients. So from our perspective, it's a perfect blend of kind of mixing our healthcare into the community.
So just kind of a quick overview of diabetes prevention. So this is a year-long program. They're meeting with other individuals who are working on prevention and or working to get their diabetes under control. They meet with our health coach or wellness coach. So there's groups, there's lots of different seminars and connections that we make. We have a partnership with North Shore Health, and so we utilize their services as well. All 3 programs that we'll talk about today are endorsed by the CDC. Actually, multiple have been invented at the YMCA and adopted by the CDC. So just kind of moving forward from that, as you saw with this one, it is open to anybody, but we do see as we're aging a little bit of a increase in our risk, and also the amount of clients that we see are in that aging population. So the next program would be Enhanced Fitness. In particular, that is for mobility or arthritis. That is by far and away our most popular program that we implement, and it is building a community within a community. So we see a lot of people that build relationships within that program, and then they have an accountability partner, and then they start coming to the gym more regularly, not even necessarily to work out, but just to have that social connectedness. And then the third one is our blood pressure self-monitoring. And I will be completely honest, that is the most difficult one to implement. We have spent a lot of time this past year doing corporate visits and trying to get employers even on board with recognizing employees who have high blood pressure, and it's not super easy. It's such a common thing. So many people have high blood pressure. It's not even a bad word. It is just like, yeah, I have high blood pressure and I take medication for it. So, but our goal is really to kind of change that and get people to understand and want to make a change. So the program for that is also, it's a combination of self-monitoring, teaching them how to self-monitor, lots of educational seminars that go along with that, and then again, creating that group and that community so that, yeah.
Sorry,
No, it's fine.
to jump in, but are you guys tied with the Valparaiso YMCA, or are you guys separate entities? Because I know there's two kinds of YMCA's.
Yes, so we are separate.
You're separate.
Yep, mhm.
Okay. I will tell you that the Valparaiso YMCA has a full-time nurse that's employed by Community Health Systems that sits in there and does exactly this for them.
Yeah.
Have you reached out to them?
It's the same program.
Okay.
Yes, yeah, and we have done the same thing. But she will also tell you that it's very hard to get people to buy into continuing to self-monitor. Yeah.
Okay. But what I'm saying is, have you reached out to Community Health System to put a full-time nurse in your location?
So we did. We used to. Our partnership was with St. Mary's prior to, but we've been with North Shore now. This is our second year.
Got you. And they won't put a nurse in?
I'm sure if we asked them, but that nurse there is also trained in the exact same program that our staff is trained in.
Okay. Sorry, I apologize.
No, it's okay. All good. But yes, it is. That's the same, exact same program, blood pressure self-monitoring. I am not sure which other evidence-based programs they have. I know that they do Livestrong and Valpo, which is the for cancer patients.
Well, the only reason I ask is because if we can get corporate funding to do that versus public funding, we'd be better off from a budgetary standpoint.
Gotcha. Yes. So North Shore also can do the same thing, like,
Right.
but it's
Corporate funding too.
yeah.
Different corporate.
Well, I mean,
Yeah.
St. Mary's is paying for that nurse to sit
But
there and
it
do
seems
this
like-
versus Porter County having to pay to sit there.
No, but I mean, if North Shore is assisting in
Do they have a nurse there?
We do have somebody that comes in on a regular basis.
Okay.
with blood pressures.
Perfect. Okay.
But that's not the entirety of the program.
Gotcha.
So checking blood pressures is one piece of it, but there's a whole other slew of stuff that comes along with the program.
science, yeah.
Yeah.
And may I ask, do the people who participate in these programs also pay a Y membership fee?
Not necessarily.
Okay.
So programs are separate from membership. So if you have a membership that's saying you're allowed full access to the facility, you can come work out whenever you want. So we have some people that just participate in a program. So there's just a program fee in order to do a program typically.
Participate in one of these programs for a fee and not necessarily
Yep.
be a member.
Yep. We've had weight loss programs in the past, so same deal. Somebody might come in and just want to do that program.
Do Y members then have access to this via their fees they've already paid?
Yes.
Okay.
So yes and no. So the Enhanced Fitness, it is part of a Y membership. So they can come join that program. It's part of their membership, no additional charge. With some of the other programs, typically there is still an additional charge. It's just a membership allows you a discount.
A discount into one of these?
Yep. Good questions.
So I remember meeting you earlier in the year, and you had given me some, the Y has accumulated a bunch of data of the health needs of our county, and how it showed that we had a large population of people who are diagnosed with hypertension, have been prescribed medicine for hypertension. However, they're not compliant in taking their medicine. They have everything there, but they're just not taking it.
True.
What does this plan do to help fix that gap?
Yeah.
You brought to my attention.
Yeah. So again, there is. It's nice to have somebody, as we talked, sitting there, being willing to take blood pressures, but it doesn't mean that people are going to be like, I won't come and take my blood pressure. I want to get better. So this allows us the ability to have somebody fully dedicated to that. So we've been able, like I said, to go out to corporations and talk through some of these issues, including we have a 3D body scan machine that we take with us, and it does literally a 3D body scan of your entire body from neck to calves. And based on World Health Organization data, it takes your waist to hip ratio, and then it gives us a predictor of how likely they are for certain chronic diseases. And so we found that being able to do that for people and have them actually see themselves and see this data is really making a difference. So then we sit and we're able to counsel them or make a wellness goals, make a plan. And we find that people are buying into that a little bit more. But obviously that takes some additional manpower. It takes a lot of our time to be able to do that. But definitely worth it in the end because they really are buying into their health more than just somebody telling them they're seeing it.
Very good.
Shannon, can you explain to the board members the current status of these programs at the Portage Y and how
Sure.
additional funding from the health department would affect the status of these programs?
Yeah, so our enhanced fitness program I mentioned earlier, that is our most popular one. So we typically will have anywhere from 25 to 50 people enrolled in the program at any given time. It's typically a 16-week program. And then our goal is to graduate them out of that program, but also get them to continue exercising. We find it's, they don't want to leave, so they like it. And that's not necessarily a bad thing because we want them to still keep moving. But this will allow us to add additional time into our schedule. So right at the moment, our instructors are teaching other classes, and this allows us to bring somebody in on more of a full-time basis, really focusing just on the evidence-based programs. Same thing with blood pressure self-monitoring. I think I kind of explained a little bit. Like we really need to do a lot more outreach efforts on that and stop expecting people to come to us and say, we have high blood pressure and we want to fix that. And then as far as the diabetes prevention program, that one is new for us. So this will be a full launch.
That's great.
It is.
And how are you planning to enroll people? Or, I mean, is this just another outreach opportunity? Have this available to members?
Yes. So we have just our database. We have over 9,000 members. So that gives us a really big opportunity, especially launching the DPP. But we have some corporate partners, which is typical for most Ys. They have corporate membership opportunities. And so really just engaging with those corporate partners and offering our services. Like, we will come to you for free. We want to come to you. We want to do these 3D body scans with your employees and really have some wellness conversations. So doing that piece and then working with our partner, with North Shore, and whomever else would like to partner with us for referrals, like we're open to all of that.
Is the DPP program referral-based, or is it restricted to people who've had elevated fasting blood sugars or A1Cs or risk factors? How does that?
Yes, so the ideal situation is that they would be referred, right? So then we can have some conversations with their medical provider, so we have at least a general knowledge of where they're at. But it doesn't have to be a referral.
It's actually extremely helpful from a day-to-day basis for 23 years where you have a lot of patients that need referrals for blood pressure, diabetes, weight, and the insurance only covers it typically if they're a diagnosed diabetic and it's expensive. So just to have another resource. I had a patient this morning who, 27-year-old male, was at some of these routine incidental screenings. It was an issue, and he admitted due to some spousal direction he came in, but that's all it takes. And then just having some help so we can be doctors and direct people. So I really appreciate it. It's nice to have that help all day long.
Are most doctors aware that they can refer their patients to you?
Probably not.
I was gonna say. So what do you guys plan on doing with the marketing aspect of things?
Yeah, all of the things. Yeah, so that again is part of our goal, is having somebody dedicated to the evidence-based programs. Like, that can be her part of her job, really, is just going out, dropping off flyers, trying to get in front of doctors. North Shore is great with that partnership. I mean, they are already aware and ready to push the information out to their patients and their doctors. But it won't be easy. When we initially launched Enhanced Fitness, I don't even know how many years ago at this point. But when we did that's exactly what we did. Just boots on the ground, going from medical office to medical office, dropping off flyers, talking to whoever we.
Great. I mean,
yeah.
we have something to give to the patients as they walk out, and knowing that you don't need to call your insurance and see if a nutritionist is covered and
Yeah.
all this, and say, it's right down the street, it's available to you, there's a support system.
Yeah.
That's amazing. I think it will be extremely well received.
Are these scheduled in-person sessions? Are they, so they're like class sessions?
Yeah.
that are held at specific times?
Yeah, so all of them are a little bit different. Enhanced Fitness is 3 times a week, so for an hour. DPP starts out with more frequent meetings, and as the year progresses, they get further apart. Blood pressure self-monitoring, obviously that is a continual monitoring, but then the educational pieces are held at least monthly, where they're coming in and meeting as a group, seminars, cooking classes, everything. Yeah.
It's amazing.
Yeah. Do you have specific cohorts that enter and follow the program along a specific schedule? And then at what point do you enter new cohorts?
Yeah, so Enhanced Fitness has always been a 16-week program, but we're finding now, just because of the demand, that we're not doing it that way. We're kind of leaving open enrollment and letting them join as soon as they come in. But that one in particular, there's a fit test that takes place in the beginning, so we can see exactly where they are in their mobility, and then we can assess that at the end. The other ones, DPP will be exactly that. It'll be a cohort because of the frequency of the meetings. Blood pressure self-monitoring does have a little bit more flexibility with that one.
Would funding from the, you had sent something to Carrie, I'm not sure if it made it out to all the board.
Pricing.
About pricing? Oh, was that,
I have it in my packet.
Second page.
Yep.
oh, that would, that's funding that we would be presenting, right? That we would be providing, right? But the pricing of the programs themselves, right? Can you explain, I don't think the board got that list, because these still would not be, even if the health department funds, provide some funding, these programs are still not free to the even members, right? There's program fee associated with the two, right?
Yes. So, yes-ish. So typically DPP for a full year is $429. So even at that, broken out over 12 months, is not really an exorbitant cost. But this would allow us to bring the cost down to $200. And even at that level, we still do financial assistance. So if somebody came to us and said, like, this doesn't work for me, we're going to figure out how to make that work. Blood pressure self-monitoring is kind of the same way. And I just will clarify, we really have found with some other programs that if there isn't some monetary commitment from the person, the buy-in isn't there, and we don't see a really large success rate of them completing the program. So financial assistance is always available. And Enhanced Fitness, we made that free to our members a while back, and we found that is very successful. So, and then, with each person, obviously we can, again, figure out what their financial capacity is. If it makes more sense to be a member, we could do it that way. If it doesn't, then that's fine too. We can have a fee just for the Enhanced Fitness program of $20, and that would be fine. And again, we can do financial assistance for that.
That's great. So it would be funding the partnership with the Portage Y that would, with us, that would allow that price decrease, right, from 429.
Absolutely. And we do.
That's great.
Yeah.
Yeah.
And we do allow, we have some supplies that we provide to the participants. Typically, we'll give them a blood pressure cuff to monitor at home if they don't have one already. So that kind of helps us offset some of those costs as well.
If we do end up funding this, one of our goals has been to get more public outreach for the Board of Health. Is there any plan as to how to potentially promote us supporting you guys?
Yeah, whatever you would like us to do.
A true partnership.
Yeah.
Yeah.
Yeah. Well, and I think we help promote each other.
Yeah.
We have our social media platforms that, has definitely been skyrocketing and those things together.
Just even something up that should they need assistance, it would be there for them to use.
Are you guys,
Quick resource.
are they included in the findhelp.com?
Yeah, I was just gonna say the Find Help.
I think so.
Yeah, they are.
Stay in the Find
I think
Help.
so. Find help.
Okay.
Because I mean, that's a very, that would be a very
Yeah, that'd be good.
helpful
Yeah.
outlet, because, not everybody needs to be, have mental health issues or
Right.
whatever. I mean,
Yeah, there's all kinds of
Yeah.
help that's
exactly.
Find Help.
And I know a lot of elderly people, it's just education, and figuring out what a lot of these things are.
Absolutely.
And I think sometimes people just need to have like a human being to talk to. Like, they'll take their medication, something about it doesn't make them feel good. They don't have the time to come back to talk to us about it. Then they just don't take their medicine.
Or they're taking
then-
it on an empty stomach.
Yeah, and just so that if they have like a human being that they're like discussing this with a few times a week,
Never heard that.
could be so much more helpful to get everything, monitored and stay on top of.
Yeah.
And other people in the same. with
Exactly.
the same focus and the same goals.
Exactly.
Right? Like,
Yeah.
just
Like
Build some of the confidence.
Yeah.
Being aware
And a
of
support group, kind of.
Yeah.
I think
agree.
brilliant.
I can
Come out of our office. Keep
At
them
least-
strong.
At least they're
That's what it does.
compliant to care.
And rely less on us.
We lost Dave.
We did. Oh, yeah, he's.
He had a phone call.
Oh, okay. Does anybody else have any other questions for Shannon?
Thank you.
Yeah, thank you.
Good deal.
Thank you.
Really appreciate you and what you do for the community.
Thank you.
And just a clarification, are these amounts that we see here, is this for a year?
Yeah.
Okay, so then that would cover these programs.
Yep. Okay, thank you.
Are we at a place to where we as a board vote to partner with the YMCA for these proposed financial support needs?
If that's something that you guys would choose to do now, yeah, then we would entertain.
Could I make a
Whatever you-
motion
Yes.
to support that?
So a motion to support the financial support request from the Portage YMCA in regards to these three specific programs. So Dr. Fleming was a motion to support.
Yes.
Have a second?
A second.
Okay. Dr. Watson,
Yes.
Dr. Brunt,
Yes.
Dr. Fleming,
Yes.
Robin,
Yes.
Dr. Osan,
Yes.
Terry.
Will you please come back and maybe give us an update?
Oh, absolutely.
How,
Yes.
Yeah,
She
just
doesn't
because I always,
like-
I like the positive.
You look our glow.
And she has a lot of data. Like, they get a lot of data.
Data, yeah.
She's a data person.
Yeah, we do actually have to collect data. We have a system called RedCap. And so for YUSA, we put everybody in that system when they start the program, and then we track them at the end. So, yeah, which is obviously why they're CDC endorsed programs, because as a collective, YUSA, we've been able to provide some really great data.
That helps.
So she has
Which will also be helpful.
state data. I reach out to her for data all the time. Helped me a lot. So
The fact that she needs to collect data
Yeah.
is helpful for us at the Porter County Health Department
symbiotic.
that also needs to collect the data, as Chris will be, our grant manager will be collecting that data and reporting it to the state also and reporting it back to us. So we'll definitely, we will really appreciate hearing from you in the future about how it's.
I was kind of thinking, since Shannon's so familiar with Red Cap, maybe she wants to do all of our reports.
What you're getting yourself
I'm just kidding. I'm just.
I have a person.
You're gonna have.
Person. A shared person.
Thank you.
Thank you.
Thank you. And like I had said, Sheriff Ballin was going to be here tonight, and he was not able to make it, so we will have him present in March. And we hopefully will have things that we can get out to you ahead of that. Dr. Boxham and I went there and visited, and they are instituting a whole wellness wing within the Sheriff's Department, and his vision is that this would be for all first responders in Porter County. So all first responders collectively, and it also services the population within the jail. And so we were very impressed, and we would love for you to hear what he has to say and proposal he has for us when we have that. So stay tuned, and if you guys have any questions about that, let me know. And then I promise I will not take up a ton of your time. I just kind of wanted to share the website again. So as you will see, Demetrius had mentioned last time they were able to move this here, but what we really wanted was for this whole thing to be the actual button. So apparently you can't just do whatever you want on the website like we would like, but they were able to put the button here. So this links to our Find Help white label, and then this links to our Find Help white label. And so now what they are all in the process of doing, and that's the whole community resource network with Sam and Carrie and Demetrius at the helm, is to get this page customized. So they did come up with 10 of these categories and then 9 subcategories underneath them that were voted on and approved. And so right now, Find Help is in the middle of implementing that. I think we were thinking like this week that would get up. And then Carrie, and I don't know if you guys see here, but there have been additional programs added, which is wonderful. I think probably about 20 almost. And Carrie is in the process of making contacts with everybody, and either, if they're not on there, recommending them and then getting them to claim their page and update it, or getting them to claim their page and update it, because that will be key. So for example, for the Portage YMCA, we can actually see if there's anything on here right now. Valpo. So here's Portage Township. And so Carrie will send this to Shannon and ask her to review it, see if everything's up to date, see if there are additional services to add. The more information that's in here, that's where it helps for the page to be connected in all those different pages in the search menu. So on the back end, Find Help does all of that, where they hook the page to whatever different categories and subcategories it needs to be based upon their services. So you might have the Portage YMCA might be in 10 different locations, a result of 10 different searches or 10 different click through the categories and subcategories. So it is not, it is definitely a marathon. But there's some progress each and every day, and people are really, really excited, and we're really, really excited. And I can't wait to show you next month what our customized categories and subcategories look like, because it's going to allow all of our parks to be on there, theaters, all of those things where people can just get out, get connected, which I loved about what Shannon was saying, and get involved in a lot of different ways.
I feel like I saw Hilltop post about it, right? Did Hilltop do like a little promo about it?
Yes.
So that was nice.
Yes. Oh, and that's the other thing. I apologize. Carrie has made the contact with the Facebook groups that you had recommended, and so she's in the process of getting them out information. In the meantime, any group that we've been at, talked to, she's been sending the file. We've seen it pop up in a lot of people's. We were at a big meeting for a group that we're putting together with Tobacco Coalition and PATH and Hub, and she pulled up her email, and there it was at the bottom of Carrie from the Tobacco Coalition's email. And we were on a website the other day, and it was on their website. So we are
Nice.
yes.
Well
And
done.
on our county website, it is under the trustee tab, and it's right there with a little blurb that Lee put together about that. So
Do we have access to how many people are actually going to the site?
We do. We
Okay.
get reported metrics. So we will, and I don't know a lot of details about that, what we can see, Carrie and Demetrius, what kind of,
So while our website is up and live, they haven't really turned on the metrics because we're still going in and fine tuning the navigation bar and the subcategories. Once we have that in place, then they'll turn it on and we'll get a better understanding, because I'll be honest with you, I'm not probably in there 10 times a day as I'm looking things up, and so we don't want false numbers.
You make the numbers go.
So that will be coming, I think, once we get our navigation bar, and then we'll get more.
Concrete.
This is really beautifully coming along in such a, like, from a dream to reality in such a quick, I mean, it's the, first week of February. Impressive. Well done.
they also have a blast that's prepared, but we're really waiting to get
Yes.
those things kind of ironed out to
All
get
those
that out.
trucks to
So it'll be very, very soon that will be going out. And then I just kind of wanted to, and we'll do this every month until you guys get tired of it, but in the Health First Indiana tab, I just wanted to link to, in that strategic plan, the updates on page 13. So we'll just continue to update this, and this is live, so we fixed it, and then Demetrius put it up right away for the things that we voted on last month. And then as we progress through that, this will be constantly changing and updated, as well as, I have to remember where I was. Our community partnership. So this is something that we have added, and I just wanted to be able to show you, and we're still trying to work out some kinks because we actually think that the website operator may have to do some of this, but our plan is for each of the partners that we're partnering with, not just through HFI, but that we partner with in general, that we will have a blurb about that partnership and feature the way that we're working together and things like that. So right now, this is linked to what was on the state's website for this, but our hope is to have just a page about community or St. Mary's and the Porter County Health Department and the Zach Mago Foundation and what we, our partnership there. And so that's kind of the vision. We're just trying to figure all of that out. So right now, when you click on extension, it just links to their webpage. But again, we're going to have detailed information about those partnerships with personal photos and things like that. So that's the plan there. And then, of course, this is the page where we're listing out all of the things that we have approved to put out for notification. If anybody has any questions about any of that, let me know. And then, as Dave said, we have a meeting tomorrow where we're going to kind of talk about the drafts of contracts and MOUs and some other things that all the nitty gritty to get ready for. I also wanted to give a quick update on a couple of other things. So I wanted to introduce, last month we had talked about how Chris has now become our grants and contract specialist. And Kendra from our office is our new office manager. So you guys will see Kendra at all the meetings. So we want to welcome her. And then Lisa is now our billing specialist from the office. And then we are hiring Kelly, she starts Monday. Yes, as a new vital records clerk. We would really like on March for all of the employees of the health department that are able to attend the meeting, just so that we have a lot of new faces.
Yeah.
And just so that everybody can be introduced and we can kind of put the face with the name and the division and all of those things. So that's our hope for March, just to let you know. In grant news, I know we had talked last year about grants. Our grant cycles are July 1st to June 30th, so we are starting to get requests for grant proposals. So we have received those for the immunization grant that we have historically had, for the Public Health Emergency Preparedness Grant, which, as you know, employs John and Jeff. And we look to be receiving them also for our Health Initiatives and Challenges Grant. That's our lead and tobacco. And so we will keep you updated. We did submit a letter of intent to partner for the Public Health Emergency Preparedness Grant. That grant cycle is starting over. This was budget period 5, and it will start over in another 5-year cycle, beginning in July for budget period 1. And so we did submit a letter. They just asked, that was a pretty quick turnaround. They have to know how many counties are thinking of it in order to submit to the CPC for the funding. Then once they get that, then we apply for that funding. For immunization, again, it was a pretty quick turnaround to submit our information. And so once we find out if we would be considered, then we will, I think that's what we decided, kind of confirm with you guys, that was something that once we know what that amount would be. So, and we do really look forward to having the lead and the tobacco grants again as well. So we're really hoping that those continue. A lot of the grants are ending at the end of this budget period. Our school health liaison is ending, and that is to be taken into Health First Indiana funding. And of course, the supplemental immunization grant that we were getting, things like that, that will be over as well. Just an update on our expansion. We did receive word that due to some HVAC things that were discovered when they kind of got up into the ceiling and into the walls, the cost of the expansion, the remodel is going to, it's about 20%, between 20 and 25% higher than we thought. So we made the decision to go ahead and instead of putting out for bid right away, we're going to push that to the end of the summer. Typically, when contractors are looking to bid jobs they can do during the winter, it's more competitive, and that can help us on the pricing benefits. In the meantime, we are looking to see if we can get approval to use some grant funding that we have for portions of the expansion and remodel that would have to do with immunizations. So we can potentially use some of those funds that we have to be able to do the remodel as planned. If that doesn't work, then we will change course, and it will be a little bit of a smaller scale than we thought, and we will keep you updated about that. So that's just wanted to make everyone aware of that. And if you have any questions, let me know.
When will you get more information regarding that?
So right now, we've contacted the state about the possibility of using the grant funding. So our grants are reimbursable. So when we spend funds, then we submit to the state and they reimburse that money. So in a grant fund, the COVID immunization grant fund, we have monies. But because this would be considered capital, we have to submit for approval to use those funds for that purpose. And so I reached out and asked what they would need. The state has let me know. The architect is now putting together that information. So then we submit that to the state to receive the approval.
So to clarify this HVAC issue, the brunt or we are responsible to pay for all of this as the health department.
Yes, that's exactly what Chris asked.
It's a good question.
It is.
I'm not gonna.
The county's building, right?
Yes.
Yeah.
Yes.
Great.
Right.
Like, I don't know why this all falls upon us to fund, but I don't want to
Right.
it down, but
I know. And we were in the same boat. And so just what has happened is apparently the air in our department in particular is simply being recirculated. So
just our department.
and I don't know that it's just our department, but it's not ventilating correctly. So
Yeah.
our air is constantly just being recirculated, which obviously is not something that we desire.
No.
We are doing at any time, but especially not, offering clinical services, things like that.
And during a
Putting
renovation.
in a restroom, doing a renovation, that kind of thing. The architect has been very careful, and he has said it may have been code at that time. They're not sure. Typically, when they would do a remodel, a smaller remodel of a larger building, they would be able to grandfather in what was code at the time. The problem is twofold, that our renovation is large enough to not be able to do that truly, but also that we just truly we should not do that. And Chris did inquire about that, and they're just, at this time, there aren't other funds from any other.
So if we can't get this covered, then the whole plan changed.
Yes.
Well, or is delayed, right?
Correct.
So we can use 10% of our HFI funding for capital
But we've already earmarked that
earmarked
for this.
for 2024 and for 2025. So it would push it out. It would push it out another year. It can be saved.
Well, no,
But-
because the ARPA funding has to be committed and spent at a certain point.
Oh,
So it's,
the ARPA
yeah.
funding has to be
Yes.
done by the 2026?
Yes, yes. So then therein lies the problem, because we don't know, because the HFI is budgetary. We have no idea what we would be looking at in 2026 as far as, like, we would be able, if we had any idea, we could do that.
Right.
That's the
We
problem.
could anticipate
Yeah.
potentially, but we wouldn't have any definite numbers.
I mean, but regardless of whether or not the project moves forward, I mean, that needs to be fixed.
It does.
Yeah.
But it
Right.
falls upon us.
Right,
Fund it.
right.
Only the HVAC system in our area.
I don't know. That's all that's
That be-
being looked at.
That be.
God forbid we find out.
Air move.
It seems like that would.
I mean, during
that
COVID,
would-
restricting air is not a good idea.
Responsible
Like,
for the
if
whole-
there were other people whose HVAC systems are also impacted by this remodel, would they not be responsible for their part of it?
That I know. Yeah, and I should have asked more, questions to understand how it all.
Simon.
Thinking like in a whole
Yeah.
building, like if we only by a certain percentage,
Yeah, I mean, I think that
Not getting anything.
they're only adjusting
Correct.
like what they're having to touch in our, and because we're getting into the ventilation, we're installing a restroom. And so they're having to run the vent fan. And so we were looking at different ways. There were 2 ways that could have gone. And so they were trying to determine what was the best. And I'm sure that that's when they got into that, figuring that out, so.
So hopefully, because a lot of the nursing section remodel really is to be setting up a good place for our vaccines, secure, a larger room, those kind of storage issues, and administration issues that the hope is that the immunization money can be used for the grant or for the remodel too, which is, so we're just waiting to hear.
Yes, and putting out for bid later actually could really benefit
Yeah.
us, not just cost-wise, but also because there are no elections in 2025.
Right. So the-
So the conference room will be fully available, and we won't have to stage our remodel in the way in which we were looking at having to do that. So
I
that could
always look to you to
be a benefit as well.
Yeah,
blessing in disguise.
I guess just keep us posted
It sure will.
and we'll
Any other?
Yeah.
think positive vibes.
Yeah,
Thank you.
Yeah.
Thank you. Commissioner Magnus is very, very positive. She's much surer of me than I'm sure of me. That's okay. We're working through it. So, and then the only other thing, and I hope I'm not missing anything, so please holler at me if I am, but I just wanted to point out that Tia is with us tonight, and she is a VU nursing student. Tina Horn, whom we share with the Porter County Tobacco Education Prevention Station, the coalition, they have a very long name. She brings the nursing students through and she has them with her. And when Tia came through, we happened to be going to host. I don't know if it was that night or it was the next day, but regardless, Tia came and volunteered to host with us, and then she's here tonight. So we're pleased to have her, and we're hoping she keeps showing up. We love it.
Thank you. Yeah.
When do you graduate?
In May.
Oh,
Exciting. Yeah.
terrifying and exciting.
Soon. It is too soon.
No more loans.
Yeah.
Money.
Then it's time to pay him back.
Any questions for Carrie? All right. I'll go ahead then.
Yes, thank you.
So, all right, a few things for you all tonight. In front of you, you will have a draft. This is not the finalized health officer job description for your perusal. It is 3 pages, so I don't expect you to read it all here. And at the end of it, I have some plus minus questions that, I haven't figured out quite how to add in. Please look at that. If you see any grammatical errors, please let me know. If you see anything that doesn't make sense to you or have any questions about or things you think should be added in, please let me know. Anything you want different. We kept it in kind of this format because for the health department, our other job descriptions are in these kind of sentence format as far as the duties and the position requirements and such goes. So that is that. And then I also gave you a copy of January's vital records, which we just finalized today. And I wanted to bring it to your attention because we're using the new format. If you had a chance, I'm sorry I didn't print. I should have printed out December's for you to have in front of you too, which was sent with your documentation for the meeting. So I'm trying to get to a format that can be used and compared with other places. So we are using these numbers that you'll see. So there will be mental disorders, that's F01 to F99. Those are ICD-10 coding nomenclature. So these are how, if somebody is doing research on diseases across a spectrum, they will use this nomenclature for defining purposes. So we will be able to, before we kind of had, oh yeah, I think heart disease is a good, they'd been our categories for 40 years. So I felt it was important to have something that we can use and translate to compare to other counties, to compare to other states, to compare to the United States, those kind of things with our vital statistics. That said, there is going to be a little bit of a learning curve because our vital statistics clerks are not medical. This was also the problem with how we did it before, is they were just kind of looking at cause of death and saying, yeah, that sounds like heart disease, and putting it in the heart disease pile. So now we are having, and I'm working with the nursing department to go through and look at the causes of death, which is not an easy, it is not an easy endeavor. I was going over this with Jess today because there are, on any given death certificate, there are 4 lines for causes of death. And then there is a section on other contributing factors. And when doctors fill it out, they may put very little information. They may put a ton of information. And you need to figure out which line really is the pertinent cause of death that would give us the most help. Example is someone who puts cardiopulmonary arrest as their top, right? Which means their heart stopped. Well, yes, that is how people die. So,
Thank you.
so then you need to go to the, then you need to go to the next line. Well, then they had an acute coronary syndrome, or something. And then then you're like, okay, they had a heart attack. And then we can put that under the circulatory system. And we also have the ability, my awesome vital records data clerk has a secondary category underneath each of these categories that helps us define it a little more. So we're not putting it just under circulatory system, but we are also putting it under ischemic heart disease or other heart diseases, or valvular heart disease, or any number of other, PE has its own category, those kind of things. So we're really trying to put it a useful cause of death into the database so that we can longitudinally look for it, or look for trends, or see where our challenges lie and address those as a health department. So so some of these you're going to look at and say, well, how often are we going to have hematologic and immune disorders as a cause of death? Well, it's not, or skin and subcutaneous tissues. Right. It's not going to happen very often, but I wanted them all to be represented so that they're available in case there are. We may find that we need to just remove them. If we never have a skin death, then it might not need to be on our list. It might just need to be as an option in the database, but not reported.
So you're saying then, Dr.
I take special interest. I'm sorry.
Yeah.
Go ahead.
I was going to.
Yeah, you talk, I'm sure.
I just wanted to clarify, so say circulatory system, there's 75. If we were to break down the data and look more specifically, those would be identified for subcategory?
Yes, absolutely. So, right.
We would be able to track data-wise, like.
Yes.
A lot of them are.
So not just a lump of 75
Correct.
folks, but we would know.
Exactly.
More. more?
Right. So for example, we had heart disease as a category before, but then we would have other causes. We had 16 other causes for the month of December, which we shouldn't really have very many of given these designations. And a lot of those then ended up say in the circulatory system in a different capacity. It is a little bit of learning the language and translating things because they don't, physicians can write whatever they want to in those lines. They don't always match our given ICD-10 codes. It would be nice if they had a pick list in the death certificate
Then I
drive, but they don't. Yeah.
complain about.
This is a huge
They would complain about that. Right.
It's a huge undertaking.
Yeah.
Well, this is a great.
It's really
And you keep guessing
Hearing.
until they accept something.
right.
Right.
That our
Yeah.
data then.
I mean, I haven't,
consistent with-
but I know from home health.
Right. Yeah. So, for instance, in January, you'll see that we have perinatal conditions in here. That
They're just making.
is new, right? So we had in the previous one, we would have fetal deaths, but not if they are born. If we have a baby born super preemie or dies for some other reason, if they have taken a breath, they are no longer a fetal death. And they just would have been in here under maybe prematurity, maybe other. So I think these prenatal causes will also help us, especially with our femur.
Bird's new position.
Right, exactly.
Those,
Yes.
That's a big one.
So there's that. And if you ever have any questions about, and if you want the breakdowns, for instance, under neoplasms, if you 1 month want to see what we've got in there,
Yes.
pulmonary theoretically.
right?
Yeah.
Yes.
That would-
So under, interesting, in the ICD-10 nomenclature, I'm sorry, this is probably way too much. I get excited about this stuff, right? Is respiratory system. That includes pneumonia.
Okay.
So
infectious.
not infectious.
Yeah, I would
right?
make that infectious.
Right. It is not under the ICD-10 nomenclature. It doesn't fall there. So, and we can break it down. We were looking today. We can break it down by aspiration pneumonia. That is separate than other types of pneumonia.
Acquired versus-
So, exactly.
I apologize, but
Sure.
point of clarification, how do you die from the genital urinary system?
Right. So included under there
I would think sepsis.
Right.
is kidney failure.
Okay, all right. Oh,
So both
okay.
of those two from this month, I looked at those specifically for that reason.
Like, okay,
Yes.
all right.
Kidney failure, acute and chronic, is considered under that nomenclature.
Gotcha, okay.
Yeah. So then the final thing I wanted to mention to you is maybe the physicians in the room have seen it. There was an IHAN from the state that came out about a rabies in a skunk in southern Indiana. So we have not had rabies in a skunk in Indiana since 2004.
Oh, my.
However, it is endemic in northern Kentucky. So it's not, I mean, it got across the Ohio River somehow. I don't know.
That's to-
But it does change how vigilant people in southern Indiana are about post-exposure prophylaxis. In our area, it's almost always due to bat exposure or stray animal exposure that we can't identify or collect or quarantine the animal, right? So, but that's how we generally work it here. It doesn't change what we do here, but probably it'll be a little bit, we'll probably be a little bit more vigilant. In the past year, we've had 33 individuals that have been referred to us for prophylaxis after exposure for rabies. And here we provide the vaccine. There are 6 doses, if I remember correctly. Is that 7 doses? 6 doses that are given in addition to the
Monoclonal antibody.
IG. So That has, we have not carried that. Oops, I have that here. So the HRIG is given IM, and we have always referred patients to the infusion clinic if they have not gotten it in the emergency department. So the emergency rooms carry it.
Okay.
And they will give it. The infusion clinic carries it, and they will give it. It is, it's over $1,000 a dose, but I can't imagine, I actually don't know exactly what the infusion clinic will charge
Yeah, true.
for giving an IM HRIG. We are looking at what it would potentially cost and how long it could stay on the shelf for us to have it and be able to administer it
Yeah.
here. So that is a possible cost savings. And we have had people, so how many this year? 2 individuals were recommended to have prophy for rabies and did not follow through. So if you understand rabies at all, it is a very long latency incubation period. They talk about 2 months up to a year.
Yeah.
So people think they're fine, they're all healed from their wound, and then have the potential. And I don't know if you remember 10 years ago, maybe a little bit more, there was that someone in southern Indiana that actually had rabies that was sick for a very, very, very long time, and the mortality rate's really high, so if you get it. So we would like to make that more available to those who really need it. And that's something that we're looking into.
I'm just excited by the fact that nobody died from old age.
I did.
Oh, that's this year we had nobody die from old age. And we have that.
A good trend.
We have that as a category because the state will accept that on a death certificate, but there's no ICD-10 code for old age. So we had to have that as a
Well, then I
category.
can't die.
Same language.
There's no
Right.
code.
Yeah.
Who's a person called?
That's on the cardiopulmonary.
Yeah, I don't know. They won't let you pick it.
Anything else?
I'm going to hand over the reins to Dr. Fleming.
Any other business?
Bye-bye.
Be wonderful. Have the agenda. Any other business to report? Otherwise, need a motion to,
Miscellaneous.
where?
Public comment.
We're at the public comment.
Thank you.
I think we're just at public comment.
Is anybody?
Is there any miscellaneous? And this is your note.
That's just, yeah.
Any miscellaneous? Otherwise, we'll move to public comment. Yes. Thanks, Darius.
Thank you.
Okay, public comment. I'm Dawn. Just a few things. For the YMCA, if the patient's PCP cannot get them to do whatever is necessary for diabetes or whatever else, what makes you guys think that the YMCA can actually get them to do it?
It's by-
So Dawn, the patient's PCP has about 10 minutes every 3 months to work with patients. Our time is very short that we actually have to interact with patients. We may have upwards of 20 minutes on a given day where we're doing a well exam, face-to-face time with a patient. To be able to have a health coach and to have other people, a cohort of other people who are going through the same thing, seen on a regular basis, has been found to be really helpful for people wanting to make change and encouraging them to make change. There are ways that doctors' offices can help affect change a little bit better, such as if their nurse calls a week later to see if they're having problems with taking their new medicine or things like that. But it really helps to have especially like Dr. Osan was talking about, to have a nurse available at the YMCA here in Valparaiso. You can walk in during business hours and just talk to Christy, right?
Can I actually?
Christine?
Because I have a very close relationship with Christy Cleveland. Christy Cleveland's the nurse at the Valparaiso YMCA, and her and I work very closely together. I send my patients to her that I need monitoring outside of appointments so that she can take their blood pressure daily, especially as they come through the door. They stop by her office and she takes their blood pressure daily, and she reports back to me their blood pressures over time, and vice versa. When she catches a patient that has hypertension, she sends them my way. So it's a two-way street that I have with her. It's a phenomenal relationship and it works really well. So I can attest firsthand to the fact that it's a very useful program.
Do you think instead of outsourcing to other resources, maybe the doctors could take a little extra time with the patient?
It's more than that. It's
Yeah.
just a daily interaction.
Yeah.
Have patients get education, time with others.
They're going to the YMCA every day to work out. They're not coming to my office every single day to get their blood pressure checked. That would be a waste of their time. So it's much more convenient for them to have somebody in the community that they're already there and they can just stop by and get their blood pressure checked.
Phenomenal resource on a daily basis.
Another question. At the county council meeting, there was $1,572,765 to the health department. Some of the descriptions are a little hard to understand. 790,552 distributed. Maybe you could break that down for us.
So we don't have the exact breakdowns on that, but that is these partnerships. So the things that we're doing that are getting approved through here, that's where those are at in the budget, because we had to plan those here and get them approved through the board and the commissioners, all that is part of the planning process. So they weren't able to be broken down specifically in the budget. So when the budget is appropriated, they're appropriated under that distributions. And then in there, as these things get approved, with the auditor's office, we make projects. And then that's how that works.
So is this money coming from the Health First Indiana?
Yes, that exact fund that you're talking about,
Yeah.
that 1161, that is Health First Indiana.
Okay, thank you.
Thank you. Any other public comments?
You're a gentleman and a scholar.
Yes.
I just have a sheet for you guys. I'll email this to you, Carrie, to give to everybody. But there was a new hearing in DC this month on injuries caused by the vaccine, the COVID-19 vaccine. So I wanted to give you guys up to date on that. I also included Dr. Peter McCullough testifying in the Pennsylvania Senate in June. And Dr. Pierre Corey testified to the U.S. Senate committee right in the, December, I think, of 21 or 20, about what they were seeing in the ICU. He's an ICU specialist. And then the CDC released the V-Safe data, and that's on here too. There's a compilation on one of these links of peer-reviewed medical papers of COVID vaccine injuries. There's over 1,000 I don't know if it's 1,000 studies or 1,000, whatever. You can see it. But anyway, I'll email this in case it's easier to just click the links, but I'd really like you guys to look at it, only because I still think the CDC is hiding stuff, and they're not telling us about this, but the doctors are talking about this big time all over the place, and why aren't we hearing about it? We're not hearing about it on any of the mainstream news media or social media apps or whatever. It's only coming from the doctors themselves. So I would like to share this with you. Thank you.
Thank you. Take your time. Take your time. Thank you. Any other public comments, sir? Very patient. employed.
Hi, my name's Andy Vasquez. I'm a county councilman and also liaison to your board and your department. One of the questions I had was the HVAC system. Unless you're running two independent systems, which I don't think this building is, there's only one, so how is the air recirculating in only?
Doesn't make sense.
It doesn't make sense, number one, so I'm gonna stop by and ask maintenance if they can look at the blueprints and see what we can do in that regard. Because if you have concerns about viruses, bacteria floating around through the ductwork, it affects everybody. Anybody
Yeah.
who breathes in this building, folks, okay? That's, I'll take a look and see what we got on that. But in regards to it coming out of your department, let's face it, it comes out of the county council budget. We're gonna have to try to figure that right off the bat. The other thing was, someone asked me the other day about that money, how much money was coming out and for that was previously mentioned. I'm gonna go to the auditors tomorrow and have a breakdown, so when somebody asks me, I have an exact answer for them in regards to where that money went and where's it coming from, so on. The only other thing I have real quick was, what did I do with it? This is what I get for writing on a piece of receipt here. Hang on, it's coming in.
Magnifying.
You're laughing, wait till you get the page.
I got 5
Well, it's not important evidently because I can't read it. But those are some of the things that I'm gonna look into, especially this HVAC thing. I used to do HVAC before I became an illustrious county councilman. And, it makes no sense. So let's find out what the problem is, let's correct it, and let's just move on with it. Thank you.
Thank you, Council.
Thank you, Councilman. We appreciate you being here.
And
Well, I'll sign my name here. It's Penny Kuzmic from Valparaiso, Indiana. I did want to address the questions, and I wish Dr. Boxham was still here. If you weren't going to the meetings, and that's how I got a chance to finally meet Dr. Stamp, during the ARPA fund meetings that they had for a whole month, the health department did apply for some of the ARPA funds, and I believe you guys got like $1 million, or whatever. Okay, and so that's what's funding this remodel. It is not coming from these health funds.
It is. It's coming from both.
Oh, you get
Penny, it's coming, oh, yes.
some from there
It's
too?
coming from both. And,
Ooh, okay.
almost a third of what we were allotted is also helping to fund the move that the veterans.
Oh,
like foreign-
so they're using that to move those, so you have more space to work.
Correct.
Right,
Okay, okay.
right.
All right. Well, I just wanted to, I thought if people weren't coming to all these other meetings, like the commissioners and council meetings and stuff, which can be boring, but they're very informing, okay? And that's number one comment. And then Lynn had mentioned that she was sending information and wondering why this was not coming out in the regular media. Any kind of additional questioning about the VAERS data and everything else. And I will tell you, I don't know if you're aware that in 2013, there was a law that was passed. Some of you may know this. Most people do not, okay? I actually noticed a change. I wasn't quite sure what it was. I thought, something's not the same with the media. Something's just not the same. Well, what it was the Smith-Mundt Modernization Act. And now the Smith-Mundt Act was an act that was passed after World War II to allow our government to pay the news to put propaganda out. It was forbidden in the United States to do that. Same way as like the CIA is not supposed to be going after American citizens, only foreign adversaries. Anyway, our media was supposed to tell the truth. There was a big focus on investigative journalism. But the Smith-Mundt basically stopped that, and it allowed our government to pay our media to put out what they want to have said. So if you'll notice, a lot of times, regardless of what news media you listen to, CBS, ABC, NBC, PBS, whatever, Fox, whatever, if you actually write down what they're saying, it's identical, word for word identical. In fact, I've seen somebody put together a compilation on one screen. I think you can probably find that on YouTube. There are all these different stations, and they're in unison. I mean, they weren't planning it that way, but they put them all together, saying exactly the same thing. So there's something that's not the same as it was 10, 15 years ago. Just giving you a heads up.
Thank you.
Okay? All right, thank you.
And if there isn't any other public statements, we'll go ahead and somebody motion to adjourn.
Motion to adjourn?
Second? Second. All right.
Good job, Dr. Fleming.
Sure.